Hi, I'm Andy Edwards.
So I'm Dr. Sherelle Hicks.
I'm Dr. Jared Raper.
I'm Andrew Bloom.
I'm the interim chair for emergency medicine.
I'm assistant program director
of emergency medicine residency here at UAB.
For residents to be successful here, they've really got to have a strong work ethic.
Hardworking
Be
resident.
hardworking.
A strong work ethic.
I think that, along with the desire to better the lives of our patients, those are really the most important pieces.
But also somebody who's flexible, who can adapt to different situations, who can make sure that they can deal with a changing environment that we work in the emergency department on a regular basis.
The type of resident we have also is very engaging and involved. We love the culture here at UAB, and that does put a lot on the resident as well, because in order to create that culture, you have to have a lot of buy-in. And so we want our residents to be very engaged and work to help establish that community.
If you show up every day with a great attitude and work hard, I've never had a resident, so in the 20 years we've been doing this, a resident who has done those two things has never failed to be outstanding.
In the last couple of years, we've really done a total redevelopment of the simulation curriculum as well as the didactic curriculum, really designed and really module-based, where we really focus on an organ system and kind of move forward. We've added our Gardendale freestanding site, which I think has been a really strong asset to our program and certainly helped a lot with the low acuity encounters that you might otherwise miss at a tertiary level academic medical center.
As the simulation director here, we have made a complete overhaul of our simulations. So we now have a full dedicated simulation day every month, where we have both immersive cases, which are case-based sims, and we have procedural sims as well. What we've really done is also develop different types of sims during that time, using that whole morning for the residents. They can do tabletop simulations. We involve our pharmacists, our nurses in a multidisciplinary and interprofessional simulation structure. It really mirrors real life for the residents. You are working with a nurse, you're working with a pharmacist, you're working with people that you do on a regular basis through a simulation activity. What's going to be happening is in the next year, we're moving away from the oral boards from the American Board of Emergency Medicine to a certifying examination, which is really simulation based. We're currently developing and actually going to be rolling out some new simulations that'll be happening probably quarterly for the residents, which will mirror the certifying examination. We've identified what procedures we need to do, what simulated cases we need, what ultrasound cases we need, that we are constantly changing as a residency and making sure our residents get the best training available and out there. And so we're going to be rolling out sims that will be mirroring that real life certifying examination. So we want to make sure that the residents are prepared and that they're passing the boards.
Some of the innovations that we've done have revolved around resident wellness. We have a really close-knit relationship with the residents and have been able to take resident feedback to change the program every year. For example, we do 8-hour shifts during the weekday and 12-hour shifts on the weekends so that all residents get 2 weekends off, which is really unusual in a residency training program. It's very much a work hard, play hard environment where we want you to come here, work hard, and be exceptional. And when you have the time off, we want you to do the things that keep you self-actualized as a human, so that you're even better when you go home to your family.
Feedback is very important, especially as a resident. You're in training, you want to grow. And so we have biannual meetings with our residents. And during that meeting, we discuss their evaluations, how they're performing clinically, any areas of concern, so that when we have our biannual, we're able to discuss this one-on-one with the residents. And so the biannual has a dual purpose. One, we get to check in with them, make sure they're not going through anything personally, don't need any support, any help, make sure they're doing okay academically. But then we also talk about their performance and overall how they're progressing through our program.
What we do on shift with residents is, I think, really important. We're sitting side by side with the residents on a regular basis, and I think what's so great about our specialty is we are very approachable. We have a direct line with our residents, with our nurses, with everybody. And so I can see minute to minute on shift if a resident's struggling, if they're doing great, if there's something else, outside influences that they brought to their shift that day. If they're tired, they're stressed. We know that the job of emergency medicine physician is difficult, runs 24/7, 365. And so what I see is those minute-to-minute interactions with our residents, and I'm able to step away, support them, and do whatever needs to be done. I think that's what's really great about our faculty in general, is that we're very supportive of our residents, and we're not punitive, we're not trying to yell at them. I want to make sure that they're going to be the best resident they possibly can, supporting them. If they need a break for a few minutes, if they need to take a lap after giving family terrible news, if they were stressed after procedure, we're there to support them along the way.
Many people have had exceptional grades, were top 2% of their class in undergrad and in med school. And as Mike Tyson said, everybody's got a plan until they get punched in the face. At some point, life is going to punch us all in the face, and it happens during residency. So when people get sick, lose a loved one, have a pregnancy, these are times where we need to lean on each other. So I think excellent intra-resident support group where each class supports their own very well. Probably all programs would say that, but residents that needed to go out on family or medical leave, we didn't have to ask for the shifts to be covered. The residents just chose to cover their friends, which speaks a lot to the environment and the tightness of the relationship between the residents.
We do know that residency can be a stressful time, so we want to make sure our residents definitely feel supported while they're here. And life goes on while you're a resident. And so we do have something called the Attending Resident Organization, which is a fund that we have created. We ask the faculty to give a certain amount, and this is something that we use to help support our residents during any time of need. So whether they recently gave birth or their partner recently gave birth, or they're going through a difficult time, something happened in their personal lives, we have funds available to help support them.
We do a lot of things. The first piece of that is kind of meeting with the residents and seeing what their needs are. And so when we kind of pick up that there's an issue, we'll have that meeting and then try to navigate how we're best able to support them. That can mean a variety of things. It may mean that they need more regular meetings with us so that we can talk about things that would be helpful. It might mean that they need some time away. And we've built some flexibility into our schedules and their schedules as well to try to make that happen. And so, whether it means a leave or whether we can try to support you through it and continue to work through it. UAB has a tremendous amount of resources, including Dr. Sandy Frazier, who is one of our physicians that will kind of meet with residents and provide what I would describe as really therapeutic sessions to discuss what their needs are and help them navigate some of the things that really come up in residency. I think are things that we need to be able to and prepared to support people through. So when we think about career development, I think the best way to consider what you want to do in the future is to practice a bit of that now. And I think we do a good job of exposing our residents to what we call the track program, which lays out opportunities that residents can select in their second year to spend time with mentors that are experts in their really subcategory field. And that can be things from education. Maybe they want to join us and develop some lectures, get involved with simulation. There are additional opportunities with EMS and going and maybe working at Talladega and spend some time developing a skill set for a pre-hospital setting. So there's a variety of things we do, and the track program is a pretty open one that we allow our residents to also have a role in designing. So if there's something that they're interested in that we haven't necessarily created a program in, whether it's admin or quality or whatever it might be, we encourage those residents to help us identify a mentor in that area that they're interested in, and then hopefully pursue that opportunity and kind of create a rigorous structure of what those opportunities would entail.
So I think we really take a big focus of mentorship in our residency. We have a dedicated mentorship group where you're assigned with a faculty and all of your residents. We want to meet quarterly with you all. That's a formal thing, but that means that we are only setting the stage to develop a great relationship with our residents. If somebody inside or outside of our mentor group needs to talk to faculty or needs support in any sort of way, we're there for them. And we've been a residency now for 30 years, and so we have a large alumni group, people all over the country that we can plug you in with. If you want a job someplace else, we'll probably know somebody who's going to get you that. We know how to talk about contracts. We know how to prepare you to become the best emergency physician you're going to be. And so we have a wide range of mentorship. We make it a big priority, and we're there to support you. UAB does great, which I've seen coming from other institutions. is we're a big academic tertiary medical center. We have all the bells and whistles, all the transplants, all the crazy stuff that you'll see at an academic center, but we're also in a big underserved community, and we get a lot of that community medicine as well. People that have not access to medications, people that have multiple chronic illnesses that come in sick. We work to build our community up.
I worked in the county hospital where there were no resources, and you learned to hustle for antibiotics for underserved and underprivileged people. And it was a great job that emergency medicine needs to do, but we didn't have the resource to see the cool cutting edge thing. Contrast that, I've also worked in an ivory tower setting where people got to do the cool things, but they frequently worked in towns where you didn't see penetrating trauma because that doesn't exist there. This is the first place I've ever seen where you get the best of both worlds, where we get to treat the coolest cutting edge thing. We have the resources to be a pioneering institution, and the things that we are doing and producing here will become standard of care in the next 10 years. At the same time, we also have the highest percentage of underserved patients in the state. And so we provide world-class care to anyone, regardless of their ability to pay. And there are not many places where you get to do that, and this is definitely one of them.
Family aspect and how we all are we really get along well.
I would have to say the people, and that's the people extending from faculty all the way to patients. We have very dedicated faculty that are invested in our residents.
I think the biggest asset of the program, and I'm not speaking of myself when I say this, but really the folks that I partner with to administer the residency, I think they're the biggest asset in addition to the residents that are already here.
The program stands out in the way that the people treat one another, and largely just following the golden rule. We treat each other the way we would want to be treated, which is the same thing we do for our patients. So when we say that there's a family feel or a friendly environment, I think all programs would say that. To me, it exists at a different level here that I've never seen anywhere else.
We like spending time together. So these mentor groups that we mentioned before, they may be assigned, but people want to do these things. And so we have good turnouts for that. We enjoy working with each other. We're not afraid to ask questions. We're not afraid to fail. And we're all trying to grow together. And so us trusting each other, being family and being close-knit is a big thing.
And our patients, I can't say enough about our patient population. We're so blessed to be able to take care of them, and we also get to learn a lot from them.
I really believe that Dr. Khoury, Dr. Bloom, Dr. Hicks, and even our clerkship team as well are really focused on how we can help make the best physicians possible. And Dr. Khoury is amazing in that he spends so much time considering the perspective of the individual resident and the level of care that he really navigates some of the issues we've had in the past. It's just a pleasure to be on that team, and I think that team honestly is the strongest asset that we have.
My experience has been that culture eats policy for breakfast every single time, and that creating a policy is a way to get people to jump over a minimum bar, but by changing the culture of a residency, we've really brought in like-minded people who support one another, who want exceptional training, who are ready to work hard and ready to give back.
I think this is a really special place, and it's where I've chosen to spend my career because it's been really great to help build the kind of culture you want to see in the world. What I mean by that is that you will not find anywhere else where people care more about you. We are obsessed with making sure that our residents have a good experience here. We want them to get the best training in the country. We also want them to be treated really well. And that is something that we can provide because we're an established program and we put our resources and our money where our mouth is. What makes this place so great is that we have a lot of really sick patients that come through here, and we're the ones that are taking care of them. So we have a very large catchment area. There are no other emergency medicine residency programs in our area. So the sickest of the sick traumas that come to us, the sickest heart failure patients, the sickest transplant patients, they all come to us. And that is mixed in with a lot of more frequent complaints and urgent care. So I think it provides you with the best possible training because you're taking care of the sickest of the sick patients, but you are also treating the bread and butter in emergency medicine. My favorite thing here is how intentional everyone is. So we can talk a lot about culture and we can talk about what makes a residency great, but at the end of the day, it is people showing up and working hard every day. And it's not just clinical work, it's showing up for the culture, it's being there for one another, it's covering for each other when maybe one of us isn't at our best that day. And I think our faculty do that and our residents do that, and we do it for one another.